Hi, welcome to our podcast. This is Dr. Ducheine. I work at Elegant Aesthetic Solutions. It's a med spa. Traditionally, I'm trained as a general, laparoscopic, and weight loss surgeon. That is, I do general surgery, and I specialize in what's called minimally invasive surgery. And then I started doing weight loss for about 15 years. Greeting and welcome to another episode of Your Health, courtesy of Elegant Aesthetic Solution Med Spa in Chatham, New Jersey. Today we're going to talk about skincare routine. That is, our perception of ourselves and perception of others of ourselves has a lot to do with our appearance to other people. That is, as we conceive ourselves to be beautiful, beauty is seen by others as someone that's usually intelligent, someone that is friendlier, someone that is desirable, and more approachable. And the fundamental issue with beauty has to do with aesthetics and skincare. And as a man growing up, I was told to wash my face and then use lotion to make sure it doesn't stay dry. But getting into the field of skincare and aesthetic medicine, to have a healthy, glowing skin requires a lot more. That is one of the first issues or thing I had to learn about skincare, which I used to watch my mom and other ladies deal with, but never paid much attention to. But skincare routine involves multiple steps, depending on your budget. Fundamentally, if you, like most men, skincare has two steps, as I mentioned. You wash your face, usually with soap, and then when you dry it, you put a lotion on or a cream. But washing your face with soap is not usually the best thing for you because a lot of the soap are very drying and sometimes they leave a film. And so the what I'm going to talk about in terms of skincare, I'm going to describe a minimum of 3 steps and a maximum of 6 to 8. Okay. And depending on your need, depending on your issues. Now, we're going to talk about the different steps. Step one is determining what type of skin do you have. Do you have uh, oily skin, which is very common? That is, you when you look at your skin when you get up in the morning, it's kind of shiny, it's oily, especially around the nose, around the eyes. That's one way. And do you have dry skin? Dry skin tends to be itchy, sometimes flaky, and sensitive skin can be red, itchy, flaky, or the most common type of skin is combination skin. And combination skin involves dry skin around certain parts of your face, for example, around the forehead um, and around the ears, oily around the nose and eyes and mouth. And sometimes also it's complicated by acne or other skin problems like rosacea, as we said, acne and melasma. But we're not going to talk about this today. We're just going to talk about simple skincare. And as we said, the first step is determining what type of skin do you have. If you're not sure, you can always ask your physician or um, an esthetician or your esthetician. Okay, first, once you determine the type of skin that you have, let's deal with the most common skin, which we call combination skin. How do you care for such skin? First, um, the first step is to cleanse. That is to clean your skin. Uh, Cleansing, depending on the kind of skin you have, will require a what we call a cleanser. Usually, the safest or most comprehensive one to use is a milk-based foaming cleanser. The foaming cleanser, you put it on your face and you rub your face gently. You put it on your hands and then you put it on your face. You rub your face gently in circular motion under your eyes, around your eyes, and over your face. And you basically let it sit there for a couple of minutes. And depending on the cleanser, some cleanser required to wash it off, some cleanser required just to pat your face dry. Okay, so if you have a dry and sensitive skin, you will use a cleanser that's hydrating, that will put some moisturizer in your skin. If you have a oily skin, you will use a foaming cleanser that usually would get rid of the excess oil and make your skin healthier for the next steps. So again, first step is cleanser, and depending on your type of skin, if you have normal or say combination skin, you would use something that's gentle on the skin, usually a milk type of cleanser that will also hydrate and cleanse your skin. And that's the first step. The second step, if you're in a hurry, if you don't have time for all the steps, that's the steps that it is recommended by most dermatologists, plastic surgeons, and estheticians to skip, will be the toner. The job of the toner is to restore the pH of your skin. That is, sometime when you cleanse it, if pH of your skin should be slightly acidic, not basic. The pH toner, basically the toner would restore that. Please stay away from astringent toners because they tend to dry the skin and mess up with what we call the natural microbiome of your skin. We know our skin have bacteria, they have trillions of bacteria, and the job of these bacteria is to balance your skin. So make sure that the pathogens of bacteria or other fungi or mites that cause diseases, this bacteria is to keep those offenders at bay. So the pH toner will restore the pH of your skin and balance it out to make sure that it's slightly acidic, not basic. That would be step two. And most pH toners just spray it on your skin. You don't have to massage it in. Just spray it and wait for it to dry. Okay. After the toner, the next steps that are involved are, depending if your skin is diseased or not, the next step would be you would introduce some serum. And also, I forgot to mention, skin care involves a morning routine and an afternoon routine. The most important of the two is the evening or afternoon routine. The morning routine is just to get you going, but the evening routine is when the skin's gonna be treated, rest, and we're gonna talk about that later. So, with respect to, I'm saying, the serum that you're gonna put in your face, you're gonna usually you're gonna use a serum that has what's called an antioxidant. Antioxidant is a serum that will help to keep your skin young and help your skin recover from the damage that it suffers from a regular daily routine. That is sun, weather, and all that. All these things can have what's called oxidating radiation, i.e., sun rays, UVA, UVB, can basically damage your skin. UVA is basically cause aging, and UVB can cause burning. That's the way you remember, because I myself had some difficulty remembering which is which. What does UVA do? What does UVB do? But the best way to recall it is UVA rays. Again, they both from the sun. They tend to cause aging, and UVB tend to cause sun tanning and sunburning. And usually, if you're in a car, usually the glass will block UVB, but not necessarily UVA. So we're talking about serum, a serum that has component of vitamin C and vitamin E. Both of those are very good antioxidant. They help to nourish the skin, keep the skin young, and also they're usually an oily base that also keep the skin moisture at a particular level. So again, step one is cleanser. Step two, pH toner. Step three is serum. Now, step four would be if your skin has some pathological problem, whether it's acne, rosacea, or melasma, then you would add your medication at step four. That is, serum would be step three, then you would medication at step four, and you would again work it in. Then you would go to step five. Step five is when you would moisturize the skin, and moisturizers have a range of consistency. They can be liquid, they can be creamy, and some of them can be an ointment. But you want to stay from the ointment moisturizers. You want to use the ones that are really creamy, because the thicker the consistency, the better, with the exception of the ointment. And I'm talking something like Vaseline. Vaseline is very comedogenic. In other words, can form blackheads and can clog pores. So we want to use a cream that would absorb in all the pores and do a much better job in terms of keeping your skin young. Again, the two parts of the skin, as an aside, is the epidermis and the dermis. What I'm talking about mainly will replenish both layers and keep your skin relatively youthful looking with a youthful glow. Okay, so we are at the level of step 4, going to step 5. Again, the first steps are: step 1 is cleanser, step 2, toner, step 3, antioxidant, the serums. Step 4 is the medication. Step 5 is the moisturizer. And step 6 is sunscreen. Sunscreen is the most important of the steps. That is, if you, for example, like a man that doesn't pay much attention to the skin, just want to get up and go, after you wash your face, make sure that if you had to put one thing in your skin, you want to put a sunscreen. And the sunscreen, you have to make sure it's SPF 30. Now, there are chemical sunscreen, there are mineral sunscreen. You want to use a mineral sunscreen um, because the chemicals have been found, a lot of them do damage to the environment and they affect the coral. And also, certain chemical sunscreen that have zinc, they would also, especially a lot of people use the zinc one when they go into the pool. It comes in it has a white filmy portion of it that basically a lot of people don't mind, but some people don't like the white film that zinc sunscreen leave, and some people even say that would tend to accumulate. So therefore, a lot of people prefer to use a mineral sunscreen. So make sure that you check if it's chemical or mineral. Mineral is better for the skin and the environment. Now, with respect to sunscreen, the important thing also is the SPF factor, sun protection factor. SPF of 30 is the minimum that you need. The difference between SPF of 30 and SPF of 50 is SPF of 30 blocks 95% of the rays of the sun that to do damage, and we may talk about UVB, and SPF 50 blocks about 96 to 97.5%. So the difference is very minimal. Also, one of the things, especially in the winter months, that you have to monitor is your vitamin D level. We know that vitamin D is made by the skin, so therefore make sure and if you're using sunscreen, you may block some of the action. So it's a fine balance of vitamin D, aggression of the sun on the epidermis to make vitamin D. So just make sure you check that as an aside, especially during the winter months. Now, after you've used the sunscreen, you can uh, go about your day. Again, just also regular thing that you have to keep in mind. Make sure whenever you're touching your face, your hands are clean. You wash your hands, and so on and so forth. Now, we're going to talk about the evening routine for skincare. Evening routine is the most important routine, more important than the morning one. All right, and it's almost a repeat of the morning routine, with the exception that certain medication that's going to rejuvenate, replenish the skin is better to put on at night, so the effect can last longer and basically keep this skin a more youthful look. Now, the first step in any evening routine is just like the morning, you're going to do a cleanser. You're going to use a cleanser depending on your type of skin. You're going to clean the skin. Then you're going to use a pH toner, step 2. Step 3, you're going to use, again, the vitamin C, vitamin E. And step 4, you may use something like a retinol. Retinol is a cousin of vitamin A. It helps to replenish the skin, the dermis and the epidermis, and it stimulates the skin. But in some people, retinol, they may not tolerate retinol in the skin. It can make some people's skin very, very sensitive. And if you're using retinol, and the reason why we use it at night it makes your skin very sensitive to sunburns, and you don't want any sunburn on your skin. So that's why you may not. It's not recommended to use retinol in the morning. Now, some people, very small percentage, do not tolerate retinol on their skin. These individuals, and it's the ultimate anti-aging, by the way, retinol. It keeps you as long as possible, keeps your skin young, free of wrinkles and folds. So, especially again around the eye. One thing that I forgot to mention, one of the steps in the morning is putting some eye gel around your eyes, because the skin around the eyes is usually the thinnest part of the the thinnest skin in the body. There's a special eye cream that you should use. In other words, if I talked about step one from the morning routine, step one is the cleanser. Step two is the toner. Step three, vitamin C. Step four is a medication. Um, then right after the medication, you can use the eye toner, the eye gel. The eye gel can have anti-wrinkle stuff in there, like lifting peptides. That would be one thing you could use in the morning. Then you would use the cream, then the cream slash moisturizer, then the sunscreen. Again, I forgot to mention the eye cream in the morning. So going back to evening, step one is cleanser. Step two, pH toner. Step three, vitamin A and C, the antioxidant. Step four, retinol. Or if your skin is very sensitive to retinol, you can use two other things. You can use something called lifting peptides. Lifting peptides are a special set of proteins that help to nourish the skin cells and keep them rejuvenated. Or you can use growth factors. Now, growth factors are the best, but you get what you pay for. They're very, very expensive. So you can use the growth factors at night. And then, depending if type of skin, you can also use moisturizer for the evening. And that would be the routine. So it's very, very important to develop a skincare routine. You don't have to do it every day because it takes some time for some people, but at least use it at least uh, a minimum of 3 to 5 times per week. Now, also, some people they choose to alternate the retinol and the growth factors or the lifting peptide, and depending on the age. So, uh, depending on your budget and depending on the time factor, will determine what your skincare routine is. If you're a man, most men are always rushing. The skincare routine would involve using a cleanser, using a toner, and uh, sunscreen. Some of the sunscreen have moisturizers, so that'd be perfect. And if you have a little more time and the skin is in good health, you can do all the steps that we talked about: the morning routine and the evening slash night routine. If you don't have time for the morning routine, make sure wash your face, throw sunscreen, and then do the evening routine. Because again, our perception of self is really based on our appearance, and our appearance and the way others see us. The more beautiful that we feel within, the more beautiful we will project to the outside, and that will influence how others sees us. Because beautiful people are believed or perceived, and we know perception is reality, uh, perceived to be more intelligent, more desirable, more approachable, friendlier. And these are very important things, other people's perception of us as we move forward. These things are very, very important in terms of even our economic outlook. If you don't believe me, please refer to the TV producers, people who work on television, and so on. If you were to do a comparison between how TV producers, not so much producers, but anchors, people that are in front of the camera versus people that are the staff that's bringing it together, that one is better than the other, but the attention to the appearances is very different. You who want to succeed, it's very important to put your best foot forward, especially at a job interview. So therefore, definitely you want to pay attention to your skin. The better your skin look, the better you feel, the more energy you'll feel, and the more confident you are, because it's all about confidence. And with this, I will have you Go out there. You can go to the drugstore or to buy these um, skin ceuticals that we call them, or you can go to your esthetician or your dermatologist, plastic surgeon, or your med spa. Again, thank you. This is Dr. Ducheine. Have a great evening. Bye bye.